and I'm the Technical and Product Development Manager at Dengie, and I'm delighted to welcome you to our webinar, Let's Talk About Gastric Ulcers, in conjunction with Rossdales Veterinary Surgeons. We've had a phenomenal response to this webinar, so thank you very much for your interest. I think some people are trying to view it on Facebook Live, and it says it's broadcasting, but hopefully you can hear us as well. Over the last 20 years, ulcers have been diagnosed much more frequently, and our understanding about all the contributing factors has increased significantly. However, there are still lots of questions that we as horse owners have about different treatment options, and as well as the best feeding and management practices for our horses. So these are some of the areas that Emily and I will try to cover this evening. I would just like to say that we have a diverse audience, so we're trying to pitch it somewhere in the middle to suit everyone, but hopefully we will cover a wide range of topics at a level that has some interest to you. The plan is to run through both presentations, then have a Q&A session, as this means that anyone who may have to leave early at least gets to hear both talks. We're hoping the technology gods are on our side, and if they are, it should mean that we can run some polls throughout the evening, and I'll try to time those where they don't distract you too much from the actual talk itself. But without further ado, I would like to introduce Emily Floyd. Emily is a member of the internal medicine team at Rossdales Equine Hospital and has a particular interest in equine neonatology. She joined Rossdales in 2009 and became a partner in April 2016. Emily's main role is working with the neonatal intensive care unit, in addition to working within the internal medicine department. In 2012, she became an RCVS specialist in equine medicine, having been awarded recognised specialist status by the RCVS. She's also a diplomat of the American College of Veterinary Internal Medicine, which she achieved during 3 years at the University of California's Veterinary Medical Teaching Hospital at Davis prior to joining Rossdales. And she has also completed a number of research projects related to neonatal foal conditions and has published and lectured widely on the subject. So tonight, Emily is going to talk about gastric ulcers. I'm going to hand over to her, and then I will try to sort out any issues if people are having trouble hearing, etc. So if I make Emily the host. Emily, are you okay? Can you?
I think I'm good. Let me just see. Right. Everybody, thank you so much for joining us. Can you hear me okay? Can you give me a thumbs up, Katie, if we're good? Yeah, all good, Emily. Yep. Thank you. Okay, perfect. Oh, I've got a weird little thing on. I don't want that, do I? Let me get rid of that. Okay, perfect. Okay, well, yeah, like Katie said, thank you so much for joining us. I'm a vet at Rossdales, and I have a big interest actually in gastric ulcers, and it's something that we deal with a lot. And so it's a great pleasure tonight for me to have a quick chat through gastric ulcer syndrome. And like Katie said, we have got quite a diverse range of people here. So I'm going to aim to pitch this somewhere in the middle. Hopefully there's a little bit of everybody. But I'm sure if there's something that we haven't covered, we can cover it in the questions at the end. So just to start with, because I think this is always one of those things that's useful, is just to visualize firstly where the stomach sits within the horse. So obviously the stomach is the first part of the main digestive tract. So you obviously have the mouth, the esophagus, and then the stomach, which you can see, which sits actually quite far cranially in the abdomen. And I think that's why when we're talking about horses that have pain with girthing, etc., you know, if you can visualize where the stomach sits, it is probably a bit more forward in the horse than you might think. This is what the horse's stomach looks like. So on that top right hand side, you can see the esophagus coming in, and then you've got that big curve around, so we call that curve around the outside the greater curvature, that little curve in the middle, a lesser curvature, and the stomach loops round, and where you see numbers 8 and 9, that's the pylorus and the duodenum, which is the outflow of the stomach, and that will all make a bit more sense as we move on. So this is what the inside of a stomach looks like, and this is really important when we're thinking about different kinds of ulcers, so we have a basic understanding of what the stomach lining looks like. So you'll see quite clearly that there's two very distinct parts of the stomach, that top white part, which is what we call a squamous mucosa, and the ventral red part, which is what we call a glandular mucosa. Now these two parts of the stomach have different functions and they have different physiology, and consequently, you know, they have different diseases and they respond differently to medications. So if you just remember that that white part at the top is a squamous part and that dark red part at the bottom is a glandular part, and we'll go through that again as we go through the talk this evening. So gastric ulcer syndrome is the new terminology. You know, it's being called a variety of different things over time. But as we've learned more and more about ulcers, we've really learned that we need to separate them quite distinctly into these two different areas. So the technical terminology is that we use the term equine gastric ulcer syndrome to encompass any kind of gastric ulcer or gastric disease in the horse, and then we can then break it down into equine squamous gastric disease and equine glandular gastric disease, depending on which part of the stomach is affected. So I think this is the question as horse owners we all want to know, and that is, how do I tell if my horse has ulcers? You know, there's so much talk about ulcers, there's so many supplements selling, people trying to sell you things to prevent your horse having ulcers, but how do you actually tell? Well, this is just an example of one of the kits which is marketed so you can do a poo test to see if your horse has ulcers. The answer is none of these things actually works. If you want to know if your horse has ulcers, you have to have the horse scoped to have a look. So this is a picture of a horse having a gastroscope, and we'll run through that in a minute. But this really is, irrespective of what anybody tells you, I'm not just saying that because I'm a vet, but really the only way you can tell if your horse has ulcers is to have a look inside their stomach. So what signs should you as a horse owner be looking for to tell you that your horse might have ulcers? Well, one of the main problems is actually that the clinical signs of ulcers are often quite vague. So these are probably the most common signs that we would appreciate. So horses with probably more severe disease, we might see weight loss, we might see a colic, maybe mild, and reduction in appetite, possibly mild colic after eating, maybe a poor coat quality. Obviously, all these signs are quite significant, but I think probably what's more common and more difficult to really get a handle on is these bottom signs. So reduced performance, reluctance to go forward, resistance to girthing, horses that just generally resist being girthed or groomed or rugged. And sometimes people report just a change in behaviour. But we just did a study looking at clinical signs in conjunction with a number of different clinics across the UK, and actually these signs are not very reliable. And again, that comes down to that thing. If you really want to know if your horse has ulcers, you're going to have a look, because many of these signs you can also obviously see in a horse that doesn't have gastric ulcers. So I'm just going to show you a quick video, if that's all right, because I think it hopefully will just highlight some of the things I'm going to talk about. So this is actually a video that was taken for the Newmarket Open Day. I'm just going to let this run and you can have a little look through it. We're a large veterinary practice in Newmarket. We just treat horses. We have a large team of people, just over 50 vets and over 100 support staff. We deal with lots of different horses, from donkeys and tiny ponies up to race horses and heavy horses. Across the practice, we have lots of different branches. We have obviously race vets, stud vets, ambulatory vets, and then on the site that we're in today, we have a hospital where we're able to perform state-of-the-art surgery, medicine, all the new equipment, so CT, MRI, all this. Today I'm going to talk you through a little bit of a procedure that we're going to do on this horse in this stable here. This is a horse that's come in. It's a racehorse who works and trains in Newmarket, and the trainer's been a little bit concerned that this horse has not been performing at its best. And one of the reasons why that can happen is if the horse has stomach ulcers in their stomach. So let's have a look over and make sure its colour's nice, he's nice and well hydrated. We're happy with his condition, this coat quality looks good. He's nicely muscled. So now I'm just going to go ahead and listen to his heart. And his heart sounds normal, he's got a nice slow heart rate. Horses have a really slow heart rate compared to people. It's about 32 beats in a minute, but I don't hear any sounds of any abnormal rhythm or any murmurs. I'll quick listen to his chest to make sure that all sounds fine. That all sounds fine, so just have a quick feel over his back. Make sure that all sounds fine. And as part of this investigation, if we don't find anything, we'll carry on and look at him more carefully and make sure he doesn't have any lameness problems or anything else. But all that looks fine. So we're happy that we'll take him down to the room now and we can give him some sedation and have a look inside his stomach. So we're now just going to get a little bit of sedation to make the procedure a bit less unpleasant for him. like, so we just have to gently pop this in his nose. Probably won't like this bit just for a second. So that's the bit they don't like, and now that's him. It means it's nice, safe and straightforward. So now what we do is we get this really long camera. So of course his stomach's obviously a really long way away. It's about 3 meters to get from the horse nose to their stomach. So we obviously have to have this really long unders bit, which can be quite tricky to use. Just a bit of label so it passes down the tube a bit more easily. So we're now going down all over into his esophagus. So we've got all the way down, quite a long way, a little bit of froth and saliva, that's completely normal. Then we're going to pop into his stomach. We hope to see it nice and empty. So to have their stomachs go, they have to be held on feed for about 12 hours afterwards. So we're hoping that he's not had his breakfast. Come back a little bit, please, Charlie. So what we do sometimes is put a little bit of air into the stomach, just using a pump like this, just so we can see what we're doing. So what we can see now is we can see inside his stomach. So although it looks a bit alarming, there are 2 colours towards his stomach. There's this red area down here and this white area, and that's completely normal. So this red part makes all the acid, and this white part acts as kind of an extra buffer. So we can see, if you look carefully, that these little red areas here are little areas of ulceration. There's some little bits of here. So he has got a few stomach ulcers, and they are quite a common problem in racehorses just because of the lifestyle they lead. So they tend to, have a relatively stressful life. They tend to do quite a lot of fast exercise, and again, that can be a reason why, when you think about a normal horse, the acid should all live down here, and as they're galloping, that can splash up onto this area of the stomach here, and it's not that well protected from the acid. So we get these little ulcers like you see here. So what we'll do now is we'll just drive on around the stomach, and then what we're going to do is we're going to just keep driving. Just keep going, Charlie. Perfect. And now we've gone right through his stomach, and we can see here this little black hole that you'll see in a minute opening up and closing is the entrance into his small intestine. So we always look at the 2 parts of the stomach. And again, if you see here, you can see this is that nice pale pink colour. That's completely normal. But we see these little areas here where we're just seeing a little bit of roughening, a little bit of reddening of the tissue. That's just a little bit of ulceration that we can see there. So what we do is we just record some pictures from his record so that we know that if we come back and look at it again, we see how bad it was. And certainly this horse probably would benefit from some treatment. We can use drugs to reduce acid suppression in the stomach, just the same as people would have. So horses can be treated with 𝗪𝗪𝘳, which is commonly what's used in humans as well. And that would hopefully, if we can reduce the acid in the stomach, that should hopefully make them feel a bit better. You can come back to Charlie. So what we'll do now is just come back, have one more quick look around the stomach again. So we tend to grade ulcers on a grade of sort of 0 to 4. And so these are still relatively mild. I'd probably grade these about a 2, which means that they may be making him possibly have some relevance to his performance, but equally they're not so bad that I would expect it to be a real problem for him. We also take some pictures to record the horse's record, write it all down, decide if the horse needs treatment, and then at the end of that, reverse it, take the scope all the way back out, take the plastic tube out, and that's the end. I don't know why I take the trousers, to be honest, because Right, so apologise, that's a bit cringy, but just thought it was quite a nice way of just showing, if you haven't had a horse gastroscoped, showing exactly what happens. So there's just a couple of points that I wanted to pick up on from that. And the first one is a starvation. If you're going to have a horse scoped, it's really important that they're held off feed properly. There's nothing worse than going to scope a horse and then finding you're not able to because their stomach's half full of food. And obviously that's fine if your horse, definitely doesn't eat their bed, but if you have a horse bedded on straw, or if your horse is the sort of horse that will get so hungry they'll eat poo or bedding, then it may be necessary to put a muzzle on them, just to mean you can actually have a look in their stomach. I just thought I'd comment on this. Obviously in the video we use the stocks, and obviously in the clinic we do that as well. We'll use the stocks because it's a bit safer, but obviously you can do this out and about in a stable. It's absolutely fine. If you're going to have a vet come to the yard to scope your horse, it's helpful just to have a stable without too much bedding in so that you can get all the equipment in. And then obviously, like we said, we do use some sedation just to make the whole procedure a bit less unpleasant for the horse. So I'm just going to show you this video now, just to show you a bit more what the normal stomach looks like. So we've just entered the stomach now. We're on this line that we call the 𝗨𝗵𝗁𝗂𝗪, sorry. And again, just see there's two things, at the white part at the top and then this pink area at the bottom. This is a horse with a really beautiful stomach. So you can see a really nice delineation between those two areas of the stomach. We've driven right around that big curve now, and we're going to drive out towards the exit of the stomach. We're coming through here. You can just see the scope twisting back round. And this black hole that you see in front of us is the pyloric opening, which is going to take us into the small intestine. So in a stomach that's nice and empty like this, you can keep on driving. We get to this opening here. We'll take a sharp left turn, and then we'll get into the duodenum. And so it's actually a really nice way of looking at the first part of the horse's small intestine too. So we can have a look, make sure it all looks really nice and healthy. And you can see this horse has a really beautiful looking stomach. There's no areas of ulceration. It all looks completely normal. I'll just show you this video is a little bit further down, so you can drive a bit further down the small intestine, and that funny little bit spurting out liquid, that's the 𝗨𝗶𝗁, which is squirting out bile from the horse's liver. So you can actually get quite a long way down into the first part of the horse's small intestine. I'll just show you this too, that sometimes your vet may take some little samples. So these are just some tiny little grab biopsies. It always looks quite alarming in the video because these instruments look massive, but if you look at them, we're taking tiny little samples of the lining of the small intestine, which are the size of kind of a pinhead. And we'll sometimes do that if we have a horse that's not responding to treatment as we expect, to see if there's any other things going on. In terms of the actual scoping, just the final comment to say about that is people obviously worry a lot about scoping, but actually it's a very safe procedure. Someone published a paper just recently looking at the incidence of colic after scoping, and it's a very, very small number of horses will get colic after scoping, but actually the vast majority of horses, it's a very straightforward, very easy procedure. So we're now just going to run through the two different types of ulcers, and that is important, like I said, to recognise the difference, because they have different causes and they have different treatments. So when we think first about the squamous ulcer, so that's that big white part of the stomach, and we see primary ulcers which are associated with fairly predictable risk factors. So we talk about intensive management factors, but in horses that are otherwise normal. And then we will sometimes see secondary ulcers, and they're ulcers that happen in a horse where for some reason they're not emptying their stomach normally. And obviously the effect of that is their stomach's not emptying, that they get excess acid built up in their stomach and they can get ulceration. So if we think about what a horse should really be doing in life, these sorts of native ponies are a good example. Horses should really be out foraging, a lot of the time, eating, fairly rough forage. And so this is a horse's stomach with a massive big food bolus in. And this is completely normal. You see all that forage gets packed down, it gets chewed up, and then it gets compacted by the stomach. And you can imagine the effect of that is that you haven't got lots of loose liquid splashing around in this horse's stomach. That big ball of food is quite good at buffering the acid. So if we look back at that picture I showed you at the beginning of the inside of a horse's stomach, we see that the bottom part is the area where all the acid should really be concentrated. So the bottom of the stomach is really acid with a pH of maybe 1 or 2. And because of all that big food mat which is buffering all the acid, as you get higher up the stomach to the level of that white line, the 𝗪𝗵𝘁 and the squamous mucosa, the pH should actually be fairly neutral, so maybe 6 or 7. So what happens in these horses that get squamous ulcers, this is an example of a horse that has really bad squamous ulcers. So you can see, instead of having that lovely crisp white line that we saw, we now have this really horrible kind of fibrinous looking mat with all that normal tissues eroded, and you can see some of these lesions are even bleeding. This is a horse that's got really horrible ulcers. And I think if you can maybe even kind of appreciate that these lesions are kind of happening in stripes up the stomach. And one of the reasons for that is the fact that you kind of get this acid splash effect. So what we should be hoping in a normal horse is that this white part of the stomach is being buffered by this big fibre mat. It shouldn't really be coming into contact with acid. But in horses where that's not happening for a variety of reasons, that acid can splash up and contact this white area of the stomach. And if you get prolonged contact with acid and some of the other factors from the stomach, you get this loss of the normal stomach lining. We obviously grade ulcers, and that's important so that we can see how severe they are. So we grade these squamous ulcers from 1 to 5, and you can just see some examples there of progressive amounts of ulceration. So why do horses get these squamous ulcers? Well, like I said, they tend to be fairly predictable. So if you think about race horses, they tend to be the sort of classic example of a horse that gets squamous ulcers because they tend to be quite stressed. They tend to spend a lot of time in the stable. They often do a lot of fast work every day. The effect of fast work is that where their stomach is compressed, that actually can help exacerbate that acid splashing. They are not always having large meals before they exercise. They often have relatively high starch meals. And they often are quite stressed, and stress is one of these recurrent themes that we'll come back to, that these horses often have a reasonably high level of background stress. And with these things, you can generally predict which horses will develop ulcers. And for example, things like withholding feed can be a reliable way of causing ulcers. In people where they're trying to study the effects of different drugs, just by withholding feed from horse for 12 hours on, 12 hours off, you can actually induce ulcers in the majority of horses. So that's the squamous disease. We'll now talk about the glandular disease. So we've already said that this is that bottom part of the stomach. It should normally live in acid. So that already means that the cause of ulcers can't be acid on its own, because it's normal for this part of the stomach to live in an acid environment. This is an example of a really beautiful normal stomach, and these are all the normal factors which keep it healthy. So you get local production of bicarbonate. That's obviously an alkaline substance. It buffers the acid at a cellular level. We have a really high blood flow to this area, and again that has a protective effect at protecting this barrier. We have lots and lots of mucus production. Again, it just generating this barrier which keeps the cells underlying this away from all that acid. And we have a high cell turnover. And all these factors are what keep the normal part of the stomach healthy in a normal horse. So when we have a horse that develops glandular ulcers, this is an example of a horse that's got really horrible glandular disease. You can see this horse has got a combination of different things. It's got reddening, it's got that sort of fibrinous colour, it's got some dark red, almost bleeding lesions. And this is a horse where we've lost some of those normal factors. So, sometimes changes in blood flow, changes in the local mucus production, changes in the bicarbonate production. These are all more the factors that we're thinking about in horses that have glandular disease, unlike squamous disease. Again, we can grade these glandular ulcers, and I will still do this because I think it helps us all to understand the severity. But actually, there's suggestions that we shouldn't really be doing this. Actually, you can see even in this picture that these types of lesions look a bit different. So it's suggested now that rather than grade this glandular disease, you use these variety of descriptive terms, which can be a bit complicated, but just give you a better description of what the actual lesions look like. And if I just show you some examples of the different types of lesions, there's different ways that you can describe these, but the suggestion is that you shouldn't be getting a distinct grade. So if you do have a horse scoped and they have glandular disease, don't be surprised if you don't get an actual number per se as to how bad the ulcers are. So what about risk factors for these type of ulcers? Obviously really important. These are all the factors we talked about in squamous disease, and the answer is we don't really know how important these are for glandular disease. And certainly glandular disease seems to be a lot less predictable. That probably these things do play a role. So, horses that are stressed, horses that do a lot of fast work, probably diet plays a role, but it's certainly much less clear-cut than it is for the squamous ulcers. These are the things that we do know are related. So there's certain types of horses which seem to be prone to glandular ulcers. So warm bloods, for example, seem to have a higher prevalence of glandular disease than other types of horses. And exercise is important, but in a slightly different way. So when we're thinking about squamous disease, it's often horses that do quite high intensity exercise which get ulcers. Whereas for horses that get glandular disease, one of the biggest factors seems to be repeated bouts of exercises. So horses that aren't having rest days, horses that are exercising 5, 6, 7 times a week, even at a fairly low intensity, seem to be at a high risk of ulcers. And other things related to stress. So there's horses that are being handled by multiple different people. Certain trainers seem to increase stress levels in horses, and there's an association that certain trainers have horses with a greater prevalence of glandular ulcers. So it does seem to be that stress is probably a greater role for this type of ulceration. The other one important thing to remember though is that glandular disease can also be a symptom of more generalized intestinal disease. And this is a horse here that's got inflammatory bowel disease, which is a generalized inflammatory condition of the intestinal tract. And we will sometimes see glandular disease disease as a manifestation of that. So certainly if we see a horse, or if your horse has glandular ulcers and maybe they're not responding as well to treatment, it may be worth considering whether or not there's some other disease processes going on. And this is an example of what you might see when you scope this horse. I think you can just see there's fun little spot lesions here that are on the lining of the small intestine. We took some samples of this, and this is a horse that had inflammatory bowel disease, and the glandular ulcers that this horse had were secondary to this disease process. So we're now just going to finish off talking for a few minutes about treatment. And obviously there's two really main parts of treatment. There's treatment with medication, which is something I'm going to focus on. And there's obviously also treatment with diet and management. And Katie's by far the expert on that, so I'm not really going to go into that, but just to acknowledge that drugs is only one part of the equation, and actually the much more important part of this situation is careful dietary management to prevent ulcers in the first place and then manage them when you have them. So what I really want to just talk about is, as a vet, and in terms of a vet describing things to owners, we obviously have lots of different drugs available for the treatment of ulcers. When I go into the pharmacy, this is our pharmacy at Rossdales, when I go into the pharmacy and I get faced with all the different drugs, what are the different things that I consider in terms of which drug's going to be the most effective for an individual horse and an individual type of disease? So to start with, we'll talk about just squamous ulcers, and this is probably the most simple thing to say, that actually oral omeprazole, which is an acid suppressive drug, it binds to the pumps in the stomach which produce acid, and it's an effective drug, and we have a product that's licensed for horses. And as vets, we have to also recommend that we use licensed products because they've been safety tested and we know they have proven efficacy. So there's two brands of licensed product available at the moment. That's 𝗵𝗄𝑧ole or Gastrogard, and these come in syringes that you can give orally. And this is probably the treatment of choice for any horse that has squamous ulceration. This is just really important. This graph is not particularly important per se, but just to say that omeprazole is a really expensive drug. The reason it's expensive is because it has to come in a special formulation. So it comes in what we call an enteric coated formula, which means that it's coated in a special substance, which means it doesn't get absorbed in the stomach. It has to pass into the small intestine to be able to get absorbed into circulation. So if you use any other type of formulation other than these specific horse coated products, it doesn't get absorbed. So these are just examples of different products that people have used, and to show that actually the levels you get in the circulation are really variable. So even though it might seem tempting to go and buy some omeprazole tablets from Tesco, they won't work. It's actually a waste of money, because unless they have that special coating, they won't get absorbed into circulation. The other question that you then think, so we think, well, this is the drug of choice for horses with squamous ulceration, but there is also some debate about what dose to use. So if you have a horse which has bad ulcers, then we use a high dose, which is 4 mg/kg, but that's effectively a tube a day for an average size horse. So for any horse that has bad ulcers, what we'd usually say is to treat them with a whole tube a day for probably 4 weeks, and then we'd reevaluate. But actually there is a reasonable amount of evidence to suggest that some horses will respond to a lower dose. So in certain situations we might use a lower dose, we might use half a tube a day, or we might use a quarter of a tube a day, and in some horses that is enough to cause enough acid suppression to let those ulcers heal. And that's really what we're trying to do with this drug, is to prevent acid production so that we give the body time to let all that stomach lining repair. As owners of horses, this is probably the most important thing. It's a really expensive drug. We obviously want it to work as well as possible. How we give this drug is really important. So lots of evidence over the last couple of years looking at the effects of feed on absorption of the drug, and it can be a bit of a tricky thing, because managing horses with ulcers, we're always so conscious to make sure they've got lots of forage, they've always got access to food, but actually this drug is not absorbed very well in a full stomach. So the recommendations that are made are that you should give this drug in the morning about 30 minutes before the horse has breakfast, and that will mean that you're much more likely to get high drug levels, you're much more likely to get more effective acid suppression, you're much more likely to get healing over a shorter time period. So moving on, then talking about glandular ulcers. Well, the first thing to say is that this drug in this formulation does not work. There's lots of evidence to suggest that if you just use oral omeprazole to treat glandular ulcers, it doesn't work. It's not that effective. So we have 3 options really that we can use. we have an injection of the same drug. So we have an injection of omeprazole. We have a drug called misoprostol, and we have another drug called 𝗪𝗪𝗪𝗪. I'm just going to run through those three options so that if you're in this situation, you have a little bit of understanding about how they work. So injectable omeprazole is relatively new on the market. It's a compounded product, which means it's made by a company who who make drugs that are difficult to get. It probably is the most effective treatment, and you'll see over the next few slides, we don't really know. There's no great studies which have compared all these drugs together in one group, but probably somewhere about 75% of horses will have healing of their ulcers in a month's course of treatment with injectable omeprazole. And the way that we administer it is it's a really thick drug that goes into the muscle, and we give weekly injections once a week for 4 weeks. The one downside I would say to this drug is that there is a reasonably high risk of injection reactions. This is obviously a really bad injection reaction. This horse got an abscess in its neck where it had been injected, but it's actually quite common that you will get some swelling at the site of injection. So I think that's fine if you have a horse that has bad disease that needs treating, but perhaps some of these horses with milder disease, then the risk of this injection abscess may mean that you're better off starting with a different drug. The second drug that we talk about is this drug called oral misoprostol, and again this can be very effective in some horses. Maybe slightly less, possibly around 70% of horses will have healing in 4 weeks, but it does seem to me, in my experience of using it, is it's slightly more variable. So some horses respond really well to treatment, and some horses don't seem to have such a good response. This is a drug that you can give orally, so it makes it a bit easier from the point of view of treating horses. It either comes in this tablet form or in a paste form, and we give this medication twice a day orally. And there is one major downside to this drug too, and the fact that this drug is a prostaglandin, so it basically is a different version of the morning after pill. So it does mean that there is some kind of safety concerns about handling this drug. Certainly if you're in a big yard where you've got lots of young people or people who are trying to have families, then this is a drug that you don't want people to be handling. So that's something that's really important to think about if you're considering using this drug in your horse. The third combination of drugs is using this oral omeprazole we've already talked about, but in combination with 𝗪𝗪𝗪𝗪. And 𝗪𝗪𝗪𝗪 is a drug which coats the lining, so it coats those ulcers and encourages blood flow, and can be quite effective in some horses. It's probably the least effective of the three options we've talked about. Maybe 50 to 60% of horses will have resolution of the problem with this combination. The other thing that as clients is a real pain is that you have to sort of fuss around quite a lot to give this combination of drugs. So the omeprazole should be given really probably 30 to 60 minutes before you feed, and then you should wait till 30 minutes after you feed to give the 𝗪𝗪𝗪𝗪. So it does mean it's a bit of a challenge to just give this combination of drugs. The one big advantage probably is that the 𝗪𝗪𝗪𝗪, because it coats the ulcers, in some horses can give quite immediate relief. So we will sometimes combine this with some of the other medications. Just one more comment about treatment. When we talked about those horses that have inflammatory bowel disease, we will sometimes use steroids for those horses. And so if your horse has ulcers as a manifestation of more generalized disease, then there may be other treatments such as steroids that we may consider using. This is a really, I'm sure this will be a question someone will ask, what about supplements? If you Google gastric ulcer supplements, there's absolutely millions of supplements. The answer is there's no really good evidence that any of them are particularly effective. The one thing that there's a little bit of evidence to suggest is that feeding some corn oil, possibly can have some effect at helping to prevent ulcers in some horses. But I might leave that to Katie. She probably have a few more comments about that in her talk. So just to summarise, ulcers are pretty common in horses. The clinical signs are variable. So if you're suspicious, then you really need to have your horse scoped to make a diagnosis. There's a number of different treatments available, but it really depends on what type of ulcers your horse has. And when we're thinking about prevention, then obviously that's focusing on the diet and managing some of those risk factors we talked about. So thank you very much. This is the 𝗥𝗶𝗁 where this is how well ponies should live. And I will stop sharing now and hand back over to Katie.
Okay, thanks, Emily.
Make you the host. There you go.
Perfect, thank you very much. So, let me find my talk and slideshow. Excellent, so that's been Really fascinating. I love the video. Thank you, Emily, for that. I'll just do a little quick introduction of myself. So I've worked as an equine nutritionist now for around about 23 years. The last 17 or so of those have been at Dengie. And I'm responsible for sort of complying with legislation, both feed safety and the rules of sport. So the supplement issue is really an interesting one, which I'll cover. Mainly in the context of the EGUS approval mark. I also get to develop new products and provide technical support for key accounts. So we're very lucky that Dengie have the Royal Warrant, so I get to go to see the Queen's studs at both Sandringham and 𝗨𝗪𝘁, and probably 𝗨𝗪𝘁 has to be my favourite customer to visit. Amazing place and people. In 2017, I embarked on a PhD in veterinary medicine research at the University of Glasgow, which is another excuse to visit Scotland, I have to say, and it's also how I met Emily. So as part of that study, we were looking at the feeding practices in equine hospitals. But this evening, I've given myself the task of talking about whether we can reduce the risk of ulcers through feeding and management. And also a little bit more detail about what does low starch actually mean, you know, how low is low? And as I alluded to, we're going to have a little look at the beta approval mark for horses prone to EGUS. What does it mean and how does a company get it? And as the current chair of the little working party that set up the scheme, it's a great honour to be able to share that information with everyone and sort of really increase the awareness of it, because it's a very worthwhile scheme. But I want to start with a little ulcer story just to set the scene, really. And this was told to me by one of the most high-profile trainers we have in the UK. And you know, it's very much a bit like a fisherman's story about the huge fish that got away, because this is certainly a horse that got away from this trainer. Some of you may recognise the horse, but it went on to win the Grand National with Gordon Elliott and started life in a different yard. And this horse would come into work, do all his fitness work, but after about 6 weeks, would get halfway up the gallops and then just grind to a halt, refuse to move. And the vets at the time, and remember this is going back the best part of 20 years, so our knowledge perhaps isn't what it would be now, the vets sort of investigating the problem found an irregularity with his heart, and that was attributed as the cause of the problem. So the horse left the yard of the trainer that I was talking to, ended up with Gordon Elliott, and actually went on to win the national. When the original trainer asked Gordon how they got over the heart issue, he revealed that wasn't the problem at all. It was actually gastric ulcers. And you know, as I said, it's the one that got away. No trainer wants to lose a potential Grand National winner from their yard. So ever since then, the trainer has really put a lot of emphasis on all the different areas that you need to consider when dealing with gastric ulcers, or at least trying to reduce the risk of them. And we're going to cover some of those this evening really in a bit more detail. So we'll look at forage, the contribution that can make, the different types, as well as the implications of things like bucket feed, how much we should be using, timing, and a little bit on some of the management and exercise issues. So just in a nutshell, does changing the diet work? And there was a paper published last year by Luther et al., which was in conjunction with the Waltham research group as well, led by Pat Harris. And they compared making a dietary change with or without a 𝗵𝗫𝗁 medication. And this was in the squamous form of ulcers. They compared horses that were in work. 12 pairs had grade 2 ulcers, 17 pairs had grade 3 or above. And they changed one of each pair to the lower starch ration, so just under the 1 gram per kilo body weight of starch. The others remained on their usual diet at around about 3.5 grams per kilo body weight, and all of them received a 𝗵𝗫𝗁 for 4 weeks. They were scoped after 4 weeks and then again after 10 weeks. So interestingly, the grade 2 ulcer group, basically the dietary change didn't seem to have much effect. But with the grade 3 or worse, so the more severe cases, both groups improved, but those with the low starch diet, the actual effect continued even after the medication had stopped. So whereas those on their original diet worsened in the second period, so they were still on their higher starch ration, those on the lower starch actually showed some improvement. So this is really some of the first sort of, I suppose, publishable work that we have that shows that actually making those dietary changes is worthwhile, particularly in the most severe cases. Similarly, another study published that was carried out in Belgium, they were looking at sort of, I suppose, the kind of common clinical issues of nutritional practices in, again, squamous cases in Belgium. Now, they only had 27 medical records to refer to over a 5-year period, but it was interesting that 21 healthy horses, referred for dietary evaluation at the same time were compared and sort of contrasted. So they're trying to establish some of the differences between those different groups. I think the notable points from that study really were that only half of those with ulcers were underweight. So we often think of poor condition, the ability not to do very well, not to thrive, is actually one of the characteristics or clinical signs of gastric ulcers, but that's not always the case. It can certainly affect horses that are in good condition, and we're seeing increasingly obese or overweight horses being diagnosed with ulcers as well. And I think this is hopefully not going to offend any guests or people that are viewing us from across Europe, but I think it's fair to say in my travels over there, they are using typically a lot more cereals and a lot higher proportion of cereals in their rations than we would typically in the UK. And over there, a fifth of ulcer cases actually received more concentrates than they did forage. So by weight, they were actually receiving more cereal-based feed than they were with forage. In 86% of those horses with ulcers, the forage intake was actually lower than 1.5% of dry mass per kilo body weight. So in other words, it's what we would consider below ideal levels of forage intake. And in nearly half of them, it was actually lower than 1% dry mass of body weight. Now, going back 20 years, you used to see those sorts of low fibre intakes in race horses. Wouldn't commonly see them in any other horses outside of the discipline of racing. But again, it just goes to show that they are still, or low fibre diets are still an issue in some parts of the world. And they're most certainly still a thing. And I've taken this feeding guide from a popular brand for a cereal feed manufacturer, products currently available in the UK. And you can see there from the 600 kilo horse, it's just taken from their website. So it's sort of public information. We're not telling tales as such, but for a 600 kilo horse in heavy work, the recommendation for that feed is between 6 and 9 kilos a day. So that's 1 to 1.5% of body weight as a cereal-based feed, which I would consider really high level. So yeah, 20 years on, and low fibre diets are very much still a thing, because when you put that much cereal-based feed into a horse, there isn't a lot of room for much else, particularly in a fit racehorse. You come across trainers a lot of the time where you're trying to get them to feed a little bit more fibre, and they just say, well, the horse won't eat it. And it's not a surprise if you're feeding somewhere in the region of 6 to 9 kilos of cereal-based feeds as well. And the thing about fibre is obviously that it requires more chewing. So what we're trying to do while we're trying to get fibre in there is to increase the chew time that the horse actually exhibits. And the reason that's important is that forage equals chew time, and chew time equals saliva production. So when the horse is eating forage, the research, again, this goes back to the 1980s, they showed that a horse would typically produce between 400 and 480 grams of saliva per 100 grams consumed. That drops to less than half when they're eating concentrates. So as saliva is one of the main sort of natural methods the horse has to try and buffer acidity in the digestive tract, when we reduce that amount of saliva produced because we're feeding less forage, then we're going to start to compromise the acid buffering process. So it has a big implication for the horse and the health of the stomach. And what happens when we don't feed forage? Well, the pH of gastric juice has been shown to drop to 2 or less when feed is withheld just for a few hours. And if you compare Timothy Hay fed ad lib, the gastric pH was around about 3.1 versus 1.5 in those horses that didn't receive feed. The ideal, I guess, is, or the sort of safety zone, if you like, is trying to keep it 4 or above. And that is typically what's seen in sort of grazing. And as soon as you bring a horse off grass, there is that increased risk of ulcers developing. And again, within just 7 days of bringing them off grass, even with ad lib hay, then ulcers can develop in some cases. Timing, well, can you feed little and often with your forage as well as your bucket feed? You know, we're conditioned into that basic rule of feeding little and often. And when we're talking about ulcers, really the same principle starts to apply, particularly if you are obviously going to limit your horse's rations in some way and not feed them ad lib. Now, I'm never sure with this photograph whether the child is actually terrified or delighted, but if you haven't got a little helper that can feed a handful at a time, then at least trying to divide your daily ration into small feeds frequently throughout the day is going to be the best option. And you can't always do that if you're working or you have school commitments or what have you, but if you can get together with other people in the yard and someone puts a hay net in for you at lunchtime and you put one in at 8 o'clock at night, if they've been there at 4 o'clock, there's ways and means you can try and reduce the time or the period of time that the gut hasn't got forage and fibre passing through. And the work by Luther et al. Back in 2009 showed that more than 6 hours gap between forage meals actually did increase the risk of the squamous ulcers. So there is some evidence to show that that increased period of time without forage can be detrimental. And just a point of interest, Emily mentioned the scoping and having to withhold feed before you scope, so you can actually see what's going on in the stomach. The team here at Dengie, and colleagues, have carried out a few little trials where they've weighed the horses the night before. They're having feed withheld because they're going to be scoped the next morning. They've been able to take the weighbridge in and weigh them again before the scoping. And you can actually see a difference of around about 20 kilos overnight because the gut's just emptied out of the material that's been consumed previously. And when you think that 20 kilos is the same weight as a bag of feed, that's quite a lot of material that's coming out. And again, it shows why if you are going to use things like weigh bridges, then you should try to do them consistently at the same time of day or after the same conditions. If they've been out, try and weigh them the next time, because plus or minus a few hours of grazing could make quite a difference to their weight. And especially if they're on a diet and you think they've done really well because they've lost 10 kilos, it might just be that they've actually just been to the loo. So do bear that in mind if you're booking a weighbridge session at some point. So forages, and I thought I'd try and tackle the 𝗨𝗪𝗁 debate, is it right or wrong? Certainly studies back in the early 2000s and onwards really identified benefits from using 𝗨𝗪𝗁. So a lot of this work was done in America, Liberty et al., based at the Texas A&M University. And the benefits were attributed to 𝗨𝗪𝗁 acting, again, as a natural buffer to acidity, which was really down to its abundance of calcium, magnesium, and protein. The other benefit of it really is that it is actually also useful as an energy source. So we know that starch is a risk factor. These high starch, low fibre rations are a problem. Well, if we can use a good quality fibre, potentially with some oil as well to provide the energy the horse needs, it makes sense to do it that way round rather than using cereal-based feeds. And you can see here, alpha, in its pure form, if you haven't diluted it with other materials, would have around about 10 megajoules per kilo of digestible energy. And a traditional cool mix or cube would be around about 10 megajoules, but probably have 20 to 25% starch, whereas 𝗨𝗪𝗁 is around 2%. So you've got about 10 times less starch for the same energy value. So that's where some of the sort of positive benefits of 𝗨𝗪𝗁 have come from. But back in 2016, and I was there at the European Workshop of Equine Nutrition, the EWIN conference as we tend to refer to it, and a paper was presented that caused some confusion, and I think probably it's fair to say has continued to do so for a little while. And this paper explored the incidence of ulcers in foals, and the researchers in the published paper talk about the fact that they used the weaning process in the foals to induce ulcers. It's been demonstrated to do so. The change of diet and stress, etc., does effectively result in ulcers. So it's a way of inducing ulcers. Now, the researchers compared two groups, so three groups. They fed alfalfa chaff or alfalfa pellets or hay. And this is where I start to have a little bit of skepticism about the actual study itself, in the sense that the foals were fed 3 kilos of the alfalfa. Now, that's 7.5 stub scoops, so the round bowl-shaped scoop that we're probably familiar with in the UK. That is way, way more than anyone would feed typically to an adult horse, never mind a foal. And alongside that, they also used 2.7 kilos of oats and 1/4 kilo of soybean meal. Now, the researchers suggest that the calcium levels were similar between the two alfalfa products used, but actually the chaff was around about 40% lower in calcium than the alfalfa pellets. So again, I'm a little bit skeptical that you could say a 40% difference was similar, but there we go. So what actually happened? Well, none of the foals displayed had any clinical signs of ulcers, but the foals fed the alfalfa chaff had higher ulcer scores at the pylorus, so the gastric sort of glandular disease that Emily was talking about a little while ago. But the those fed pellets or hay didn't have them, so it was only the alfalfa chaff. So it's obviously showing that if you like, the alfalfa per se isn't the problem, it's potentially the format. But do remember, again, 3 kilos or so to a foal that probably already has ulcers through the stress of weaning. It's a very, I think it's probably fair to say, contrived situation. Now, the same research group have more recently published, I think earlier this year, a study looking at adult horses comparing grass and alfalfa hay. Again, they changed the management regime 24 hours before the study began, and their one horse with ulcers at the start no longer had ulcers when it was fed alfalfa hay. So again, the authors are concluding that the alfalfa hay seemed to have beneficial effects on the squamous mucosa, and also, and I think importantly in the context of the previous study for foals, no effect in the glandular pyloric region of the stomach at all. So what can we conclude? Well, in any age group, there was no negative effect in the squamous region in any age. So the only negative finding to date has been in these weaned foals that were obviously very stressed in the pyloric region only, and when fed much higher levels of alfalfa chaff than are typically used. So I think it's fair to say that alfalfa chaff is absolutely fine and generally considered beneficial for adult horses. You know, I've had long debates with other nutritionists from other companies, and we're all of the opinion, and I think the vast majority still use alfalfa as part of the ration and would still recommend it. But, you know, if all of that does not alleviate your fears and you are concerned, then there are options. And, you know, particularly at the time of weaning, you may want to consider that using alfalfa pellets rather than alfalfa chaff. You can use a chopped grass fibre if you want to mix it in and increase that chew time, because obviously it's going to be beneficial for that reason. The inclusion of the alfalfa pellets gives you the buffering that you get from the higher levels of calcium, and you know, the researchers advocate that themselves. So hopefully that goes some way to clarifying the situation about alfalfa. And what about other forages? Well, another factor associated with gastric ulcer lesions is a high amount of straw in the diet. And again, alluding to the fact that we are seeing a lot more sort of obese and overweight horses and ponies in the UK, one of the dilemmas that horse owners are having and contacting the Dengie feedline about more frequently is trying to find a balance between providing enough fibre to reduce the risk of ulcers, but also you know, they're not resulting in excessive weight gain. And that's where straw could potentially be a useful ingredient. Now, the study, again, you can see Lutherson is a very prolific researcher in the area of nutrition and ulcers, but she's based in Scandinavia. So when they looked at the different diets, they found that when horses were fed straw as the sort of only or predominant forage source, then there was a 4.5-fold higher likelihood of gastric lesions occurring at a grade 2 or above. But you know, who feeds just straw or predominantly straw in the UK? This is not done that regularly, and it does mean that straw can still be a useful part of a mixed ration. You know, suggestion up to around about 30% inclusion, and it's a great way of trying to dilute the energy density of other forages. If you're on a livery yard with high quality, high nutritional value haylage, and you've got a fat, obese horse or pony that you're trying to manage and get weight off, then you know, straw might well be a useful ingredient for you. Now, clearly, if you have a horse with dental issues, a history of impaction colic, and I'm sure Emily will have an opinion on that with her internal medicine hat on for sure. But, you know, we use straw as an ingredient. A lot of feed manufacturers have straw as an ingredient in feeds. So it is generally, if used sensibly, a safe way to provide fibre without too many calories. But we just wouldn't recommend it as the only source of forage that you use. And as horse owners, we often know what we're supposed to do. This was a study that we carried out in 2018 in association with Horse and Hound. We got around about 275 respondents. And I think this is really encouraging that so many people understood what the strategies that they can implement are in terms of trying to reduce the risk of EGUS. So, 96% of people understood that feeding plenty of fibre or forage to increase saliva production was a good thing and something they should be doing in the management of ulcers. Again, turning out as much as possible. I think the sort of perhaps the acknowledgement or the recognition that stress was a key factor, perhaps dropped away a little bit, and obviously that sort of feeding a double handful of fibre 20 to 30 minutes or so before exercise. Again, still pretty good awareness levels, but the trouble is, as horse owners, and we're all guilty of this, we kind of know what we're supposed to do, we're just not always so good or able, I would add, at doing it. So again, bearing in mind that 61% of the people that answered the survey knew or thought that their horses may well have ulcers, again, it's slightly concerning that some of these were as low as they were. So increasing access to hay and fibre, around about 2/3 of people were actually doing that. So although everybody kind of knew they should be doing it, only 2/3 did do it. Now that may be because they have a good doer and therefore are concerned about weight gain, as we talked about, or maybe for whatever reason, perhaps they just couldn't afford to feed more forage. Who knows? We didn't sort of probe any deeper than just understanding what they were or weren't doing. And just under 2/3 were avoiding starch and cereals. With my sort of nutritionist hat on, I would like that to be 100%. If you've got a horse that you suspect has got ulcers, then really, you need to be trying to avoid or reduce your starch and your cereal quite considerably. Increasing turnout, 57%. Now, I do have some sympathy with this. It's not always possible on liver yards to do it. So, you might want to turn out, and for all the reasons that, you love the yard because you've got floodlights so you can ride in the dark, or it's got great hacking, you might well put up with some limited turnout because all the other bits are so good. So I do have a little bit of sympathy with that one for sure. And again, quite a low implementation of the feeding double handful of fibre or alfalfa shortly before riding. So there's certainly work we can do, and I'm sure, over the coming years, we'll be trying to get to the bottom of why people finding it hard to implement all of these strategies to reduce the risk of ulcers. So just a few take-home messages in relation to forage. What we're aiming for is about 1.5% of body weight as a minimum amount of forage to be fed. We're going to talk about some specific scenarios a bit later on, but generally speaking, if you can get to 1.5%, that is the ideal. If you can, then use more of lower calorie forages such as straw for good doers. Rather than restricting their intake, the more you can give them of a lower sort of calorie forage, the better. Try to keep the time without forage to a minimum, ideally no more than 6 hours. And I would suggest, and I know it's probably a case of you would say that, wouldn't you? But I think the evidence is there to show that you can certainly use chopped alfalfa. It has proven benefits. The only really high risk category, if you're very concerned, would be your weaned foals. And in that scenario, use a grass chop with some pellets in for buffering. So the rest of the diet matters too. And again, there is quite a bit of evidence to show that feeding 1% of body weight as grain actually increases your ulcer risk even in non-exercised horses. So in that study, they were talking at between 3.7 to 5.1 kilos of grain. And to try and give you some idea of what that looks like in real term, it's about 3 scoops of mix, so that large round bowl-shaped scoop. So quite a common sort of amount of feed for performance horses, certainly for race horses, be fed at least that in most cases. And these magic numbers, again, the sort of threshold really that we're working to, and this is the criteria that we use for the beta approval mark for horses and ponies prone to EGUS, are 2 grams per kilo body weight of starch per day. That doubles the risk of ulcers if you exceed that, and 1 gram per kilo body weight starch per meal. It's 2.6 times more likely to have ulcers. So I think it's a case of what's the least worst here, both in terms of the total daily intake of starch and the amount you consume per meal. The per meal is the most sort of critical thing really. The more small meals you can do, the better, even if your total daily amount is going to exceed what we'd recommend. If you can divide it up as much as possible, then you're going to reduce the risk a little bit. And I should just actually have put a plug-in on for our website. We've developed a little bit of a starch calculator for you. So you just need to know how much you're feeding, what the starch concentration is within the feed, and you can put that information in and it will tell you what the grams of starch per day and per meal, and whether they're exceeding the thresholds that are recommended. So do try that out if you are in any doubt about the maths. And the use of oil, and it was great that Emily mentioned this, because when energy is needed effectively, as we talked about, fibre being a great source of energy as an alternative to starch, well, oil falls into that same category as well. So if you can use a combination of a good quality fibre and oil together, you can easily meet the energy requirements of most horses and ponies. And in energy terms, just purely looking at the energy or the calories it's giving to the horse, most oils are pretty much the same. There are some differences, obviously, in the types of oils. So you might be familiar with terms like omega-3 and omega-6, and the level of omega-3 tends to be what we use to measure the quality of oil. So if it's a really good quality oil, it would tend to be higher in omega-3. So something like fish oil in human terms, things like linseed in the horse. The thing about omega-3 is it makes an oil less stable. So it's more vulnerable to going rancid, particularly in hot, warm conditions. So if you're exporting feed all around the world, using linseed can be a bit risky. So as feed manufacturers, we tend to try and find a balance somewhere in the middle between using a good quality oil and one that's going to be stable wherever we're sending it to. Now, this slide is designed to be a little bit confusing in the sense that there is evidence that exists that shows the type of oil does and does not have an effect. So on all sorts of things, but also with ulcers. Now, corn and maize oil seem to be most commonly recommended. So, sorry, corn or maize oil, it's the same thing, just two different names for the same plant. But, and again, without wishing to be too provocative, but really, I just took this paper because it's actually the one, the researcher called 𝗨𝗵𝘁 that gets sort of talked about quite a bit by some advocates or proponents, if you like. But when you read the paper, he talks about the purpose of the present study being to determine whether dietary supplementation with corn oil, which is a product high in linoleic acid content, would affect the character of gastric secretion in the pony. So if the rationale is for the linoleic content, then there are other oils that would actually have more linoleic content. So I couldn't find anything else in there that was specific to corn or maize oil as making it better for ulcers than any other oil, apart from its linoleic content. And all I would say on that, and again, happy to discuss and debate with anyone that wants to make the case for maize oil specifically, but oils like soya and sunflower oil, in fact, sunflower oil has a higher linoleic content than maize oil, and soya is sort of comparable. So I think the jury's out a little bit on that, and probably looking at more data and doing some follow-up work would be interesting, because if there's something about maize oil, that's fine, but if it's just relating to the linoleic content of that oil, then others are usable. And again, I just wanted to use this slide to sort of illustrate how you can get energy without having to resort to starch. Now, to be fair, some of these are the more traditional feeds that are out and about out there, and there are newer ones which I'm going to talk about in a bit, but all this slide is really showing you is that for comparable energy levels, so on the sort of left hand of the slide, I hope you're not seeing it reverse, but you can see the DE value, so it ranges anywhere between 12 and 13.5, and that's megajoules per kilo of digestible energy. So they would be the highest sort of levels of compound mixes and cubes and things like alpha oil that you would be able to get. And then on the other side, you've got the starch levels that come with those feeds. So anything that's cereal based, you can see there are some lower ones there at 13%, but it can be right up as high as 30% odd. But when you look at the combination of alfalfa and oil, it's down at 2. And as I say, whether it's our alpha-8 oil or someone else's equivalent product or similar things that combine fibre and oil, the point is you are getting energy without having to have the starch as well. So it is feasible to fuel a horse at high levels without having to resort to cereals and the starch that comes with them. Now, there are some lower starch cereal-based feeds on the market, some of them more recent than that slide has got on, but the lowest I can find is around about 8%. And when you put that up against a fibre and oil combination, it's still 4 times higher for the same energy value. And I said I'd sort of talk about how low is low. Well, a lot of people describe their mixes or cubes as low if they're in the region of 15 to 18%. And, that's fair enough compared to something that's a traditional racing ration that might be 25 to 30%. But, it's a relative thing. And certainly within a cereal manufacturer's range, they're going to talk about low being low compared to some of their other feeds, and particularly the more traditional ones, whereas there are still further lower options that you can go to. It might be things like sugar beet as well, great way of providing digestible fibre that is actually a very low starch feed material. And again, I just took another example of an ingredient list of one of these low starch sort of cereal based feeds, a mix for want of a better word. And you can see most of it is fibre. It actually had a little bit of molasses in. I don't necessarily see that as a completely bad thing. I know some people are anti-molasses, but it's predominantly fibre in the form of soya, beet pulp and grass pellets with some oil and your vitamins and minerals. And you can achieve the same end result by using grass pellets and sugar beet and other fibre sources and use it with a balancer. Now that may be a more complicated way of doing it, I appreciate, but just because these things are branded and marketed as being the sort of low starch options, look a bit deeper. They're not always the only way to do something, and they're not always the lowest starch options available to you. Just to touch on exercise, so again, ulcers can actually appear after only 8 days of training, and an Australian study showed that the risk increased by about 1.7 times for every week of training. And if you remember back to my Grand National winners story, after about 6 weeks, it was so bad he stopped. If anyone wants to put in the chat box if they know who the horse was, you can win a bonus prize if you let me know your name. I will tell you the answer at the end. And again, horses on a high-speed treadmill showed increased abdominal pressure and decreased stomach volume compared to when at rest. You can see when the horse is moving, everything, all the acidic contents in the stomach are going to be pushed up and come into into contact with the lining of the gut. So it's no surprise that you end up with some ulceration. And again, the sort of demonstration that if you feed horses prior to exercise, there were less marked changes as a result. So that feed acting as a physical barrier or almost like a sponge to sort of soak up the acid and try and offer some protection for the stomach is really important. And there's an EGGD, so Emily talked about the 2 different types of ulcers and their consensus statement that they issued. At the point in time of this consensus statement, they were talking about the fact that there isn't really any established link between EGGD and diet, but however, they still recommend that all the good management practices associated with turning out high fibre intakes, etc., and using your chopped fibre before exercise were recommended. Interestingly, and I think this was found in racehorses and show jumpers specifically, providing a minimum of 2 rest days from work per week rather than 1 was actually beneficial. Now, we had a question came in before the webinar started about what do racehorse trainers do. In my limited experience of trying to get racehorse trainers to give them 2 days off a week, it's been a bit of a struggle because the perception is they need to put the work into them. But I suspect that if you have a problem with EGGD and you can't resolve it with medication, and they are notoriously difficult to treat, a lot of the time, and I'm sure Emily will comment on this, but a lot of the time you're looking for an improvement sometimes rather than complete resolution, certainly in racehorses. You may well actually then start to be more open to doing things like a minimum of 2 rest days. But until you've got that problem and it's actually sort of stopping your horse from running and performing, trainers are often quite reluctant to give them that extra day off compared to normal. And some other considerations, and again, I really would appreciate anybody's thoughts and comments on these. Emily in particular, really, there was some preliminary work that's indicated that the effect of using omeprazole to treat gastric ulcers is the possible reduction in calcium absorption. So this effect is seen in humans. It's now thought to affect horses too, although I would say it's one study, which was published again in 2019 by 𝗨𝗏 et al. Whether or not it is sufficient to contribute to bone demineralization, which some trainers are sort of attributing an increase in fractures, is yet to be demonstrated. But certainly the recommendation from the research group that carried out that work was to try and increase the calcium intake in horses receiving omeprazole. They actually looked at, I think it was for marine origin, so things like seaweed or something along those lines, as the source of calcium. But again, you could make the case for alfalfa because it is rich in calcium, it comes from a plant, and therefore it's more bioavailable than mineral sources such as limestone flour. And again, another one just to be a little bit thought-provoking for those of you sort of very interested in the effects of all these medications, the change in acidity levels and the effect on the microbiome as a result, because if we make it less acidic, then it allows some more harmful potential pathogens to make their way through the digestive system. And again, in human context, it's potentially making us more vulnerable to pathogenic bacteria. I think that paper cites the 𝗕𝗘𝗧𝗪𝗏𝘃 in particular. So there are many variables in this area, obviously, like the length of use that you're going to be using omeprazole for, the diet and the health of the gut in other ways, but they're just designed to be, I know there's some vet students joining us this evening, so designed to be a bit more thought-provoking in these areas as well. So some case studies or ideas for different areas. So if you are one of those people with a good doer and you're worried about the risk of EGUS, or in fact they may well have it, then the emphasis needs to be on the little and often forage. That's got to be your number one priority. So if you're having to limit the amount they're consuming because they're just expanding rapidly, we're trying to aim for 1.5% body weight as forage a day on a dry matter basis. But if if you're having to restrict to that, then even still you should be trying to divide it into lots of small meals if you can. And then in theory, all you need alongside is a balance or a supplement appropriate for the level of work the horse is doing. If you have, at the opposite end of the spectrum, a poor doer with gastric ulcers, then again, you can sometimes have the dilemma of what forage to use. So would you use a fermented haylage that might well be more acidic than something like a grass hay? Well, in our experience, a wrapped hay, which is dried almost to the point of being a hay before being wrapped, it's too dry to actually ferment. So the acidity level is exactly as it would be for a traditional bale of hay. And again, you've still got the same levels of sugar because the fermentation process hasn't occurred. It's not turning the sugar into the acid that preserves the forage. So they can be a little bit more digestible because they tend to be harvested earlier, and so therefore can be quite useful for a poor doer. They're a bit softer, a bit more digestible, the horse is going to get more from it, and if you can feed it ad lib, all to the good. What we would suggest is turning out, but only if the horse is happy there. So a lot of people, if they're stuck on a livery yard and all the other horses are coming in before you can get yours in, and that causes your horse to be stressed, then it may not be appropriate for them to be out there becoming stressed by their friends coming in and then being left out. So it's got to be a practical arrangement that works, that keeps the horse's stress down. But if you can turn out and you have the luxury of good grazing, then that's obviously a great option. And the sorts of feeds you can use, well, we've talked about a combination of good quality fibre with oil, obviously to get that high calorie content with the low starch. Then you can use other digestible fibres as well, so things like unmolasses sugar beet. Again, sugar beet causes confusion because the name implies it's going to be full of sugar, but if it's unmolassed, the sugar has actually been removed for use in the human food industry, so what we're left with is a pulp. And that, if it hasn't had molasses added back in, it will be less than 5% sugar typically. So a very safe way to condition a horse. You could use a balance or a supplement to balance that ration, because effectively it's straight. And then if you can, use something like a digestive enhancing supplement, such as yeast, live yeast. They've been shown to improve fibre digestion. And what we're trying to aim for here is the horse being able to get more out of the forage that you provide them with, which means you are reducing your reliance on any sort of cereal or concentrate feed, which is going to help the health of the digestive system. Poor doers with EGUS aren't necessarily always old. If they've got dental issues, for example, they might have the diastemas, which again are increasingly being diagnosed. Whether it's an increasing problem or not is another matter, but or more common problem. We just are finding them, a bit like ulcers, we're finding more of them. Use your soft chops, so soft fibre, something that's grass-based, if they can chew that more easily. If they can't manage even a chopped fibre, then you can use things like soaked grass or soaked alfalfa pellets. Obviously, you're getting that buffering from the alfalfa compared to the grass, so either a combination of the two or just the alfalfa is a good way to get that buffering in the digestive tract as well. And you just feed them on a weight for weight basis. So you need to make sure that you're providing enough. A light chop in a scoop is only about 300 grams. So that's where the volume is really important. So if you can weigh your feed and make sure you're giving them enough and achieving that minimum forage intake, that's obviously the key to getting it right. And again, just to sort of show that you can look good and perform on these kind of rations, this is 𝗨𝗵𝗁𝗁, one of our supported riders, and her horse Pooh. She was diagnosed with diastemas and ulcers. So the diastemas had caused her a lot of pain, so she wasn't eating enough fibre, which I believe had sort of contributed to the ulcers. She lost a lot of weight quite quickly. And so once they sorted the diet out, and again, this was on the nutrition team that worked with 𝗨𝗵𝗁, got the diet right, so in a sort of soft mash type consistency, but it's no bar to being able to perform. So she completed the 3-star 3-day event at Tattlesall's on that kind of a ration. So it just goes to show that you can fuel work with a fibre-based diet. And I think she's a great example of a fit, lean horse in good condition. We sort of sometimes struggle to know what is optimum condition, and she's a great example of how a fit horse should look. So just finally then, what does the BETA approval mark for horses prone to gastric ulcers actually mean? So it is an independent assessment of feeds. So yes, you do have to pay an annual licence fee to be a part of it, but it's open to BETA members and non-members, and it's a reasonable fee. It doesn't stop smaller brands and smaller companies from applying. It shouldn't be a prohibitive scheme to be a part of. The feeds have to meet certain criteria. So I mentioned those sort of numbers, the 2 grams of starch per kilo body weight per day and the 1 gram per meal. They are the criteria that any feed that has this approval mark has to meet. And as part of the approval process, we have to submit all our packaging and marketing materials to the Veterinary Medicines Directorate for their approval. And the idea of this is that it should stop companies making false claims. So again, I had a couple of emails prior to this evening with people asking, so which supplements, are they all just marketing ploys? Well, if they are making claims that they shouldn't, then it's probably why they haven't applied to the scheme in the first place, and that would apply to feeds or supplements. But in fact, it's the Veterinary Medicines Directorate that don't really like the use of a supplement. So unfortunately, supplements are excluded from the scheme, and that's not through BETA, that's through the VMD. Now, the Veterinary Medicines Directorate are the people that actually approve all medicines, and rightly so. They protect the companies that spend hundreds of thousands, if not millions of pounds trying to get medicines approved for use. And it's not fair if products that are non-medicinal try to make medicinal claims. So that is why the VMD exists, and it's why they try to stop, rightly so, feed companies making claims that would be considered medicinal. But as a result, what it means is that we cannot impose any requirement for a sort of inclusion of a positive ingredient. So in actual fact, it's more about what isn't in there that makes it suitable for a horse or pony prone to ulcers. And ultimately that's really the starch level. So no feed or supplement should make a claim to treat, cure, or prevent disease. They only reduce the risk of or are suitable for horses and ponies prone to. To suggest otherwise is actually illegal, and as I say, it's probably why some brands wouldn't apply. Supplements, question mark, again, it is a difficult area because technically in feed legislation terms, they don't exist. They're just the same as a feed. But the VMD, as I mentioned, have a bit of an uneasy relationship with supplements as they often appear medicinal just by presentation in effect. So it was at their request that they weren't included in the beta mark. So companies, to be compliant, really should only be using phrases like maintain gastric health. You can talk about a natural buffer to acidity, but you can't link that to reducing the risk of ulcers. But again, any company that makes any form of sort of claim, functional or nutritional, about their product has to be able to substantiate that. So some of the papers we used this evening about alfalfa, we would use those in the case if we ever had to support the case for using alfalfa. But there's not a lot of those papers that exist about supplements. I've picked out a few just to talk about to finish off, mainly because they're ones that we get asked about a lot, and because they're quite recent and hot topics, I guess. So I think over the last sort of probably 12-18 months, there has been some concern as to whether turmeric is suitable for horses with ulcers. Frank Andrews et al., again, American researcher, literally in the last few weeks, have just published a study suggesting that turmeric did not cause or worsen ulcers within 28 days of feeding. Now, they quote the product they use in their paper, and it was the Smart and Simple turmeric pellets. And from what I can see on their website, there's no piperine that is in the ingredient list, so it was like a pure turmeric supplement. But on the basis that it was pure turmeric, there was no evidence that it would cause or worsen ulcers. Now, the study was only 28 days long, so they obviously caveat that for that period of time. Whether you'd see any deterioration after a month of using it, who knows? But at least we know for a month there was no issue from using turmeric. Seaweed, again, another source of calcium that appears to act as a buffer in the stomach. So generally speaking, seaweed is known to have a wider range of trace minerals, and some of the minerals, things like boron, that we haven't even got an established level for the horse requiring it, but it seems to be beneficial. FOS prebiotics, now there are some published studies again that show that it helps to regulate acidity in the stomach. Other benefits of FOS have been demonstrated in other species, so it's a more widely researched ingredient, I would say. But I suppose the takeaway message from this bit really is to contact your nutritionist. If you are considering a supplement and you're not sure about it, ask someone that can evaluate it for you. And also, most importantly, look at the inclusion rate of the ingredient or the compound or the material that you're after. Look at the feeding rate of the supplement and look at what evidence exists to support their use. And that's what the nutrition services, nutritionists can do for you. You don't have to do that all yourself. And if you want an objective assessment of a supplement, then make the use of the resource available to you. So I think that brings me to the end. I've seen questions popping up, but I'm not very good at multitasking. So apologies, I haven't looked at them as we've been going through, but we're just going to go to a Q&A session now. So if I stop my screen share, and Emily, if you're there, if you want to unmute as well, and I'll see if I can rattle through some of the questions that have come in. Right, where are we going? Emily, I'm going to start this one for you, if that's okay, while I have a look at some of the others. The question is, I have a horse that's repeated return of pyloric area ulcers. His scope's clear and then they return. We've followed all of the guidelines from the vet regarding food, etc., but they keep returning. He's young and weak and his work is tailored to allow for that, and he's not pressured. What can we do? Will we have to be on omeprazole and 𝗥𝗏𝗏𝗁 permanently? Are you okay to answer that?
Yeah, definitely. That's a great question. And I think actually that's, Deborah, I feel for you to start with because it's a difficult one. And I think there's probably a few things to say. Sometimes, as Kate alluded to, these problems are very difficult to treat. So some horses have refractory ulcers. And we always get the feeling there probably is some other factors underlying. I think one of the challenges you have when it's young horses like this, that sometimes it is just stress related, and stress is a big word, isn't it? But you know that they are finding, you know, some degree of underlying stress, and until you know you get them a bit further through this, I think it can be a really difficult thing to manage. Your comment about the orthopedic thing, I think, is also really interesting, and that we definitely see some horses that have glandular ulcers associated with other underlying orthopedic problems. So I would suspect that, you know, maybe if he's young and, you know, you possibly have a few other underlying things going on, that they may be contributing factors. I think if you are managing everything that you can already with regards to, you know, you can't find any lameness to treat, then probably what you have to do is just to really focus on the diet, as Katie alluded to. That's a sort of horse I would definitely be giving oil to. That can be beneficial, and just use medication as you need to. But it certainly is a difficult one.
Got to unmute, sorry. That's great, thank you. There was also another one that came in prior to this evening, Emily, where they sort of seem to see a bit of seasonality. So I'm just reading off the sheet with their the incidence or the occurrence of the ulcers. So we only scoped to rule ulcers out, as my vet really didn't think he had them, but he actually had grade 3 ulcers and hindgut ulcers too. So bad that the vet didn't really want me to ride him. 6 months later, we got a clear scope. He'd been fine since, but I've kept him on the same diet, haven't changed anything. Then exactly the same time of year, he starts with the sweating and being tired again, which was what first arose their suspicions. Just wondered if there was anything that can be done as the seasons and the grass changes. So ulcers isn't normally what we think of as being a seasonal issue, but I don't know if you've got any thoughts or comments on that one.
Yeah, actually someone else asked the same question actually in the chat list too. The answer is I don't know, but I definitely agree that it's a problem that some horses seem to have around that sort of October, maybe September, October time. Presumably it is the content of the grass is changing. Probably, maybe you want to comment, Katie, but presumably there is some relationship to that. And I don't know, a lot of horses also have some management changes, don't they, at that time of year, associated with maybe reducing turnout. So I think probably they are some of the factors that are involved, and they are definitely difficult to manage. You know, probably just trying to maximise forage. You know, the more things you can keep consistent, so forage, for example, maybe backing off a bit with exercise at those times of year. I think just trying to manage other factors that you can, acknowledging that you can't change you can't control the change in the grass or whatever.
Yeah, and do you have any thoughts on the hindgut ulcers? I know that can be a bit of a sort of
yes, I think in the context of the question that I don't know the name, sorry, that person asked, when they say their horse had scoped and found hindgut ulcers, and suspecting maybe they'd meant, you know, the pyloric or glandular ulcers, because you can't identify hindgut ulcers by any means actually. So you know, when we talk about hindgut ulcers, we're actually talking about disease of the large intestine, and really that relates to probably ulceration of the lining of the large intestine, and that probably is actually a very different disease. So the two main reasons why we get that are horses that have an encysted small redworm burden. Actually, that's the most common ring. So horses that have, you know, a high number of encysted small redworms, or horses that have underlying inflammatory bowel disease. And so they are slightly different things. So again, a lot of supplements and different things are targeted towards hindgut ulcers, but actually I don't think they're as common as people think, and they're certainly quite difficult to diagnose.
Yes, and I think this is a great question actually. Have gastric ulcers been noted in any other herbivorous species, e.g. captive exotics? So I don't know if you have any experience of rhinos or elephants, but have we come across anything of that?
Yeah, my knowledge of rhinos and elephants is not good, so I'm not going to comment on that. The one thing I would say is that actually, because obviously the anatomy of, you know, goats and cows and things is very different, we don't get the same, you know, the horses are really the only ones to get that degree of squamous ulceration that we see. You certainly can get some of the pyloric problems, or you know, you get abomasal problems in cows, but it's a bit different. The species that's probably the most similar actually is dogs, and things like sled dogs and husky dogs, where they're doing high levels of exercise, will get some glandular disease, and that's probably the most comparable thing, I would say. The other animals, I'm afraid, I don't know.
No, I mean, I guess anything that's designed to be, sort of eating fibre and forage and that chew time and saliva buffering. But is horses' saliva very different from other species? Have you come across anything on that in terms of its buffering potential?
Well, this is like a very difficult vet school quiz. The answer to that, Kate, is I'm not sure.
Yeah, well, let's investigate that one. That may be one that we follow up on at a later date, because I know my fascinating fact is that I think, other than white rhino milk, I think the mare's milk is one of the lowest fat milks there is. But whoever it was that milked a rhino to find that out,
yeah,
rather them than me, quite frankly. But let me just have a little look, because I think there are some more questions that come in on email as well. One was, can ulcers get worse with treatment? I'm not sure if we'd want to admit to that or not, but have you had any experience?
Yeah, I think that again, that's a great question, and it's a real life question, isn't it? The answer is I think it's the same with all drugs. Different horses respond to different drugs in different ways. So in some horses, you might find that actually they respond really well to one drug, and another horse doesn't respond at all. And so I think there is some individual response. So I think from that point of view, definitely yes. The one other thing that probably is quite important too is that the oral omeprazole, so either oral gastrogard or oral peptazole, there are some horses that just don't absorb that drug well at all. So actually, I would say that, do some horses get worse from treatment? They definitely, there's a few horses that don't get better, and actually, I guess maybe they get worse if they're otherwise stressed. So I guess it's not impossible. The vast majority of horses, I can reassure people, don't get worse on treatment though.
And there's also another one. Do non-steroidal anti-inflammatories increase the potential of both types of ulcers?
Yeah, great question. So non-steroidals are probably most likely to be associated with glandular ulcers, and it's definitely one of those things we consider a risk factor, because they can have a negative impact on the blood flow in that area of the stomach. I think the reality is that's not the most common cause of problems in horses, and actually horses that have high levels of non-steroidal, so bute or any of those drugs, are much more likely to get problems in their large intestine actually. But it certainly is a theoretical problem, although I don't think we don't see it that
commonly. Sure. Okay, so if you have an owner that's extremely keen on a supplement to prevent the ulcers recurring, what would you recommend? Is there anything you would go with first of all, Emily? And I'll buy myself some thinking time on that one.
I don't, as a general rule, recommend supplements that often. I will sometimes, in horses, there's a small subset of horses with squamous disease where maybe some of the antacid type supplements can be beneficial, but my personal view is that none of them are that effective.
No, and I think a lot of the time, I think it's probably fair to say that the other sort of factors contributing to the problem are going to outweigh any changes you make or any supplements you use, rather than, should we say, changes. But obviously, I think if an owner is keen to use or do something, then first port of call is obviously to make the dietary changes, get the starch level low, and just something that, like the digestive enhancing supplements, so something like yeast, which is very innocuous, it's certainly not really doing harm, or the 𝗨 prebiotics, where we've got a little bit of research, they're going to have benefits through the gut generally. So that would be something that we would sort of first port of call really, alongside your management changes. But the antacids, I think it's the extent of, or the length of duration that they're actually going to have an effect for, that really brings into question whether they're going to have a huge difference or not. I mean, we include them, we use them, but it's as part of a complete sort of management and dietary approach, not just in isolation. So I think that's the key, isn't it? It's making it part of the whole ration rather than just doing one thing in isolation. what else have we got? Sorry, there's lots. I'm trying to just group them together in themes. So one person on the webinar actually asked if they've been diagnosed with, it was a pyloric ulcer, and then also the veterinary report said gastric ulcers. Emily, what would your interpretation be, that was squamous and pyloric, or pyloric and other issues in the glandular region?
Yeah, I would think probably so squamous and glandular, I would guess. So squamous and pyloric, or pyloric and glandular are basically the same thing.
Yeah. If they have both, does it change much about what you, with the approach you take with medication, or?
Yes, I think that's a really good question. I probably should have covered that. But actually, because the glandular ulcers tend to be the most difficult to treat, and actually probably what I should have said is when we're treating the glandular ulcers, the reason why we will use the injection of the 𝗵𝗲𝘳 as opposed to the oral 𝗵𝗲𝘳 is that it suppresses acid to a much higher level. And so, you know, we said, didn't we, that the pyloric disease is not necessarily caused by acid, but actually once you start to get loss of the lining of the stomach, the acid prevents it healing. So using the injection of that 𝗵𝗲𝘳 is really profound at suppressing acid. So actually that's often the drug of choice if you have a horse that has both types of ulcers, because you know the acid suppression will usually be enough to let the squamous ulcers heal and buy you time for the pyloric lesions to heal. So in those horses that have bad ulcers in both parts of the stomach, I would often go to injectable 𝗵𝗲𝘳 to start with.
Yeah. In the context, so this one, I've been told not to feed my horse chaff as he has a diastema. What would you suggest to feed him in that case? So yes, then obviously they've the alfalfa pellets or a grass pellet soaked into a mash. If you're using alfalfa, as a rule, we tend to suggest 3 kilos maximum per day of a pure alfalfa feed, just because you know, it is abundant in things like quality protein and calcium. So if you're getting somewhere near 3 kilos, you're starting to supply almost a bit too much of some of those nutrients if it's in conjunction with other feeds, you know, typical grazing, etc. So if you're using a grass-based one, then depending on body weight, really, or body condition score, you can feed it ad lib, because effectively it is a very nutritious form and digestible form of grass, but essentially it's a grass-based forage, so you could use it on a weight for weight basis. But yeah, if you're going to use alfalfa pellets rather than chop to achieve some buffering, up to 3 kilos a day for a horse maximum would be our recommendation. You can soak them up into a mash if the pellet's too hard for them to manage as well. So as Pooh demonstrated, it's no bar to being able to perform just because you haven't got great teeth anymore from a horse's perspective anyway. And then there was another one further down. Could a change from box rest to grazing bring on ulcers? It seems to be the only change in more than one case of ulcers that person's had. You wouldn't think it going that way around, but any thoughts on that one, Emily?
I would guess that's probably stress related, probably, as you alluded to, that if they're, you know, maybe the quality of the grazing is not that good, and maybe the horses are finding it quite stressful being out for whatever reason, that's probably the main thing, I would guess. Or possibly they're not getting, you know, if there's not that good grazing, they're not having as much access to forage, I would guess. They're probably the factors that are relevant.
Yeah, and another one here actually, which is an interesting one. Any research into the causes of delayed gastric emptying? So again, some debate on the relationship of this issue with ulcers, I think, but do you have any thoughts on that?
I mean, not really, and we obviously do see that sometimes, but I mean, I think for the vast majority of horses, that's not a cause of their problems. It's quite a rare thing, and probably I would say that's most likely associated with horses that have other inflammatory intestinal disease, so horses that have inflammatory bowel disease, for example.
Yeah. Has there been any research on the link between food intolerance and ulcers? Again, not to, well, not that's been reported or obviously sort of published data. It's hard to try and imagine a scenario where that would be the case. I mean, probably I would say no is my initial reaction. I might have to ponder that one and just see, but there's certainly nothing in the literature to link. I don't think we even really understand what a food intolerance is, to be honest. I mean, obviously an allergy or allergic reaction involves the immune system, and intolerances can manifest themselves in lots of different ways, you know, behavioural symptoms that people describe, or things like itchiness, but I don't think we really fully understand exactly what that is, and therefore whether it could have any impact on an ulcer. But I'd have to say probably not at this stage on that, but who knows. Emily, in terms of bacteria, I think we know from, obviously in human cases of ulcers, �ᵄ𝗃𝗁 pylori is involved, but we don't seem to still see any evidence of that relationship in the horse or any other bacterial relationship at the moment. Is that right?
Yeah, I think that's right. So certainly at the moment, you know, no one's been able to find Helicobacter, and there doesn't really seem to be any strong bacterial component, or at least bacterial cause, I should say, in horses.
Yeah. Another good one, so I don't know if you would like to expand on stress and pain. We talked about it a little bit in one of the other answers. I've been told that they can be the root cause of ulcers. Can you explain more? How would these affect acidity in the stomach? But I think it's more about breaking down the defense to acidity. But I'll leave Emily to answer that.
Yeah,
one.
I don't think, I agree. I don't think it's particularly related to acid suppression. There's probably a lot of different factors. I don't know that we necessarily understand them all. Probably some of it may be related to blood flow, that actually, the more stressed you are, you're diverting blood away from some of your, stomach and non-vital things. I mean, that could have a role. And also, I guess, stress, pain affects eating behaviour. So I think probably it's all related to those other factors rather than having a direct effect on acidity.
Yes, definitely. Do you see a common occurrence of ulcers in recently broken horses or ponies? So I guess the implication there being, is the stress of being broken in, backed, ridden, all that kind of thing, enough to result in ulcers? Or
yeah, I think that would definitely be a risk factor. And certainly we would see quite a few horses that come with a history that they've been recently, not necessarily broken, but recently purchased, for example, and that does seem to be a trigger factor. So I think any of those big changes, diet, routine, could definitely be a risk. So yes, I think that is a potential group of horses that you'd be worried about.
Yes, I mean, it's interesting, isn't it? There's quite a lot of not contradictory is the wrong word, but you can see from the changing of forage and the changing of diet that ulcers can develop quite quickly, and obviously with the increase in exercise. But again, the sort of more exercise you do, and the longer period of time you're in training, the worse they're likely to get. So possibly at the start of a horse's career, when you're just backing them, will the stress have had enough time? So it depends how long you take to break in your horse. But yeah, the stress is certainly there, isn't it, from being ridden. What are the most sort of common symptoms that you see, or sort of clinical signs, Emily? Is it things like being what we'd call girthy when you tighten the girth up and things like that, or are there other giveaway signs or telltale signs?
Yeah, that's a really difficult question to answer. So I would say, what do I think is the best predictive sign of ulcers is the fact that you can't predict it, actually. The more convinced you are that the horse is going to have ulcers, the less likely they are to have ulcers. But it does seem like it's quite variable. Girthiness is the big one, I would say, that people really worry about, but certainly I scope a lot of horses that are girthy that do not have ulcers. So certainly, there's many other factors that can cause that too. But I think probably the most common signs are maybe resistance to girthing, maybe resistance to going forward. Probably a change in behaviour, I think, is a big one. Horses that, they are behaving differently to how they have previously. And certainly, some horses that have glandular ulcers or glandular disease, you will get some of the more profound signs like weight loss, colic, but they're certainly less common, I would say.
There's one point of clarification here, actually. Can I ask, if you said to give sucralfate 30 minutes after feeding instead of 30 minutes before, does it have an interaction if given too close to the 𝗵𝗆𝗁? Does that make sense, Emily?
Yeah, so the sucralfate can reduce absorption of other drugs, so we try and space it out a bit. That's the real reason.
Okay, and then someone's getting their horse rescoped next week. If the pyloric ulcers have healed, would you recommend continuing to dose with oral omeprazole before travelling and competing in a young horse?
Yeah, so that's so we sometimes talk about this prevention dose of omeprazole. So you can use a low dose of omeprazole or a higher dose actually at stressful times. And there is some argument that may be useful. So if you have horses where you know you can't control the risk factors, may they be, exercise, travel, particularly stressful events, and you certainly can do that. Like I said, oral omeprazole is not that effective at treating pyloric ulcers, but actually possibly preventing acid suppressing in those horses before they have ulcers may be helpful. So it's certainly something to consider. I wouldn't recommend it for all horses, but in certain indications, it could be useful.
Excellent. There's a couple of specific questions on different sort of Dengie feeds and products. So someone asking which ones are softer. So I would tend to go for the grass-based chafs, so things like pure grass or meadow grass. If you want completely really soft, maybe something for a horse with diastemas or dental issues, etc. Again, some horses don't like alpha pellets. Can I use 𝗨𝗵𝗁? Yes, you can. That's a 50-50 blend of alfalfa and sugar beet unmolasses. So you're getting calcium from both of those feed ingredients as well. So you get buffering from both elements. And if the horse will eat that, then it's we can have the best diet in the world. But if the horse isn't going to eat it, it's not going to do a great job. So yes, the key thing is finding something a horse will eat for sure. And then any evidence of aloe vera preventing and or helping recovery of ulcers? Not in horses. I do have a human colleague that swears by aloe vera, but obviously, again, it's a sort of herbal product. So we would fall foul of all the VMD rules and regulations of medicines and things if we advocated it. I think a lot of these things, if you choose to use them and try them, that's entirely your prerogative. And just unfortunately, and it's not to say they don't necessarily work, it's just the fact that if we don't have the evidence for them and they're not approved, a feed or supplement manufacturer cannot make claims about them, or shouldn't be making claims about them. So I'm sure there's a lot of herbal medicines and remedies that have been used for millennia that may well have some health benefits, but it's being able to prove it in a clinical trial to produce publishable data that actually means we might even stand a chance of getting them approved. But obviously we can't advocate the use of them without that. So yeah, by all means give it a whirl. I think the thing you have to be careful of is using too many things, lots of different things at once. Firstly, you're not going to know if anything is working, and you do run the risk of them having some form of reaction or effect. So if you are going to try something, do one thing at a time, and don't sort of try those things without sorting out the original problems of basic diet and management, and treating any underlying painful condition that might be causing them stress. Emily, do you want to add to that? Have you come across aloe vera? Anyone using it successfully? Or
there's one published paper where they compared it to omeprazole, and it certainly wasn't as effective. So I would sort of mirror what you said. I think the problem isn't that we end up spending so much money on these things because we think they might help, or it's actually focusing on the other things that you've talked about are much more important.
Yes, absolutely. There's one person that's had a guess. I think it's Liz O'Neill. Well done. That racehorse was 𝗨𝗵𝗁𝘁. So if you knew that, brilliant. And if you Googled it while we've been talking, well done you. But if you message me at katie@dengie.com, I'll send you a prize. So well done. Yes, it was 𝗨𝗵𝗁𝘁 that won the national and was the one that got away from the trainer. So lesson learned there, I think. Any other questions? I think we've covered most of the key sort of general things. Some of the ones that have come in on Facebook and things, we will try and answer more specifically with some precise advice in the coming days. Bear with us on that one. Oh, hang on, is there one more? Yes, so again, some of those are the ones we'll cover individually, if that's okay. Let me just check the Q&A box one last time, see if there's anything else. Scrolling through, there's lots of questions, which has been great. Good one here actually. What's your view on the relationship between hindgut acidosis and gastric health? How would you support hindgut health? I'm going to leap in on that one in terms of supporting hindgut health. The key thing is high fiber, low starch. What we're trying to avoid is the excessive starch moving through the foregut into the hindgut and potentially disrupting the bacterial populations through changing acidity. If starch reaches that hindgut, it's broken down much more rapidly than the fibre when it gets there, and that's what contributes to that increase in acidity as well. So all our fibre digesting bacteria don't cope very well with the changes in acidity levels, and can also make the gut more permeable and things as well. So the key thing is keep your starch intake low. If you are going to use starch, use lots of small meals so we're not overloading the capacity of the foregut, and feed plenty of fibre to promote good health. You can also obviously use digestive aids. So I would say the thing about yeast is that it is a researched additive. I hate using that word, but it's a legal term, but it is an approved ingredient, if you like, in horse feed. So it's been widely researched. There are 3 or 4 approved under EU rules. So to get that, they have to have been proven to be safe and have some effect, i.e. improving fibre digestion. So again, there is some evidence to support their use, and any horse could be given a source of yeast if you want to enhance gut health or improve fibre digestion, especially if they're poor doer. They'll get more out of what you're putting in, so that would be my suggestion. I don't think there's necessarily any link between hindgut acidosis and ulcers, other than the fact that you probably haven't got a very healthy digestive system. They're quite far apart. You've got the small intestine in between. But Emily, any comments or thoughts on that?
No, I would agree. I think there's a lot of concern about hindgut ulcers and hindgut disease, but I think my main answer to clients is exactly what you've alluded to, that actually focusing on diet is the best way you can prevent and support hindgut health.
Brilliant. Well, we're rapidly approaching 9 o'clock, and I think that's pretty much answered most of the general topics and questions. So if there's nothing else, if no one else raises a hand or adds something, I just, on behalf of everyone, would like to thank Emily hugely for giving up her evening this evening and doing a great job of explaining all these complicated medications and the different types of disease. And also on behalf of all of us, congratulations, because I think you're one of the few people that actually managed to get married this year. So despite coronavirus and its best efforts, that's wonderful news. So congratulations, and
thank you very much.
Indeed. And as I said, this recording will be available. So for anyone that had to leave or missed any bits and pieces of it, we will make it available to you all as soon as we can. But thank you so much. It's great that so many of you were able to attend, and we really appreciate your participation in this evening's webinar. Thanks, Emily. Take care, everyone.
Thanks, Katie. Cheers. Bye.